Welcome to Section 1, When an FCE is Performed. I'm a visual learner. I created this presentation to help myself better understand the intricacies and interactions associated with the functional capacity evaluation. This presentation contains a series of definitions, timeframes, and videos to visually represent when an FCE is performed. Learn to generate revenue for your business and help your clients navigate through the WCB, long-term disability, and motor vehicle accident insurance as they travel from injury through to recovery. The road starts with an injury, continues through the initial assessment phase of a diagnostic assessment and a musculoskeletal exam. Then the treatment phase is reached with a baseline and benchmark assessment. This is followed by the post-treatment pre-return to work phase that contains the physical demands analysis and functional capacity evaluation assessment. The end of the road is recovery. The injury may be the result of an auto accident, a workplace injury, or a slip and fall. The primary gatekeeper to rehabilitation is the family physician. This is the typical first stop for people with a non-catastrophic injury. The diagnostic assessment. Using a primarily subjective interview style, the physician makes a diagnosis, provides a referral for treatment, and when required, gives a note to stay off work.
I'm going to start out today by just talking a little bit with you about your chief complaint. What brings you here today?
Sure. My left elbow has actually been bugging me a lot. Every once in a while I've been getting a little bit of pain, extending my arm and going back to bending it. Really that's the primary reason I've come in. I've attempted to take a little bit of Tylenol to relieve the pain, but it's not really seeming to help much.
Okay. Started about a week to 2 weeks ago. Okay, and do you recall what you were doing at the time that it started?
I've been helping my husband clean out the garage lately, and we were lifting some boxes. And that's kind of, I didn't notice it at the moment, but later in the evening it started to act up.
Okay. I would like to hear about a little bit about the severity of it on a pain scale of 1 to 10, 10 being the worst pain you've ever had, 1 or 0 being no pain. At this, how bad is this pain?
I would measure it probably about a 6 or 7.
6 or 7?
It's become more of a nuisance than an actual physical pain.
Okay.
The funding of treatment and payment of lost wages depends on whether it was a motor vehicle accident, workplace injury, or other type of accident. The referral initiates the treatment. The note initiates the claim and return to work process. The treatment provider visit. The treatment provider quantifies the injury by measuring the extent of the impairment. An appropriate course of treatment is recommended to reduce the impairment and pain levels. The Musculoskeletal Assessment. Physical tests to determine the level of impairment. The following video is just an example of a musculoskeletal assessment.
The shoulder examination. First thing to do is to expose the shoulder. In this examination we're going to look at the right shoulder. And we're then going to do impingement tests, signs for subacromial impingement. And the first test is Hawkins test. This is done with the arm just placed out in front like this, just in front a little bit like that. And then we're just going to turn the arm to see if this catches, causes pain. And they'll notice the pain just here. Put the arm down. And if they do have impingement, another test to do is to just abduct their arm. If it catches here, put the arm back down, externally rotate the arm, so turning the hand out and then lifting the arm up again, and this may free the greater tuberosity from the acromion, and if that's a little freer, that's a sign of impingement. I'm just going to turn the patient round to show you the sulcus sign, which is a sign of multi-directional instability, and we just hold onto the shoulder and pull the arm in that direction, looking for a little sulcus here. And then lastly, testing for instability or anterior instability of the shoulder, the apprehension sign, putting the arm up like that into that position, watching the patient. They may not like that. If they don't like that, that's a sign of anterior instability of the shoulder, and that's down. That's the end of the shoulder examination.
Impairment. Impairment is a loss of use, or derangement of any body part, organ system, or organ function. An impairment is when the range of motion is less than normal. Normal, in this example, is based on the AMA guides to impairment rating. In this example, the client is able to fully abduct their arm to 180 degrees. Therefore, there is no impairment. In this example, the client only demonstrates 90 degrees of abduction. Therefore, there is a 50% impairment. After the musculoskeletal assessment, a treatment is started. At the onset of treatment, a baseline FCE is performed to establish the client's current functional status. After 6 weeks of treatment, a progress FCE is performed to determine if the client's functional status has improved compared to the baseline functional status. This loop is repeated until the client returns to work or reaches maximum medical improvement. Maximum medical improvement, the date after which further objectively measurable improvement from an injury is not reasonably expected. At the end of treatment, we need to determine if the client is ready to return back to work. At the end of treatment, we need to decide if the client is ready to return to work. By comparing the client's abilities against the job demands, an FCE can determine if the client is able to return to work or if alternate therapy is required. An FCE in this situation is a disability assessment. Disability is an alternation of an individual's capacity to meet personal, social, or occupational demands. Disability is relative to the required demands. Continuing with our earlier example, the client has a 50% impairment due to shoulder abduction being limited to 90 degrees. If the client's job was an electrician that had overhead reach demands, they would have a disability. If the client's job was an accountant that had only waist level reach demands, they would have no disability. Here in these images, you can see in the middle, the impairment is 90 degrees of abduction of the shoulder. This results in a disability when we look at the image on the left, where the shoulder impairment limits them from performing the overhead reach demand. And in the image on the right, there's no disability because the shoulder impairment does not limit them from performing the waist level reach task. In this video, we'll be comparing the results of a PDA to the results of an FCE. On the left-hand side, you can see the worker doing reaching at waist level. On the right-hand side, we'll be measuring waist level reaching during this dexterity test. In a second example, we'll take a look at lifting. On the left-hand side, the physical demand is lifting as the client prepares to put the product inside the box, and on the right-hand side, you can see that we're doing a dynamic lift test. And the final example is a kneeled task. On the left-hand side, the worker is cleaning product in a kneeled posture, and on the right-hand side, we're doing a dexterity test in a kneeled posture as well. In all three of these examples, the physical demand of the workplace, measured in the PDA, is compared to the results of the functional capacity evaluation.
Now, Sean, I normally take pictures as well. It just helps me later to remember what's going on, and also like to include them in my report.
All right.
That way it gives a nice visual reference to what I'm talking about. Are you okay if I take pictures?
Sure.
Okay, good. So what I want you to do here is you can go ahead and cut it, but don't open it up at the end because I want to actually measure that. Okay, so I just want to hold on a second. I'm going to get this set up so I can take a couple of pictures here. Alright, just of your, yeah, that's good. Okay. And what do you just pull it up like that? That's what you're doing?
Yep.
Okay. Just going to take my my baseline dynamometer here and just get an idea what the peak forces are on that. Good. 6 pounds. 6.6 pounds.
Here are some of the tools that can be used as part of the activities of daily living evaluation to do the functional measurements. This is an inclinometer. The inclinometer is utilized for the reaching and bending test. You can see as the client bends forward, the number would increase, or you could also be able to measure the degrees or the angle of any reach test. A goniometer can be utilized for measuring the ability for a person to reach forward. The goniometer can be used to measure the angle of movement. A grip strength device can measure the amount of strength in the person's hands. I squeeze on here, and you'll see that the dial there is going to increase. The push-pull tool can be measured to quantify pushing and pulling forces. This is a digital push-pull device. And finally, dexterity can be measured with a dexterity tray. We can do gross dexterity by moving up larger pegs, or fine dexterity and reaching by using smaller pegs.
But the 24-year veteran is back at work after going through the work hardening program here at Temple Physical Therapy in New Haven.
So the work hardening program is basically a program that's geared to get injured workers, such as firefighters, to return back to work. And it is basically designed for people that have post-surgical type of
Fortunately for Rick, the New Haven Fire Department donated a lot of equipment so that firefighters can simulate real-life job tasks.
This is to simulate the hydrant that Rick shows up to that hasn't been opened up in 10-15 years.
Every day I felt myself getting stronger, and we would add different exercises and more workload on me to get me back to be able to be strong enough to go back to work. Physically,
So the first thing we're going to do is put the chair down to its lowest height, the seat pan height, as low as it will possibly go. And then we're just going to take a measurement of the lowest plane. Now it's a challenge sometimes knowing exactly where you should take the height from, because you have this concave in the seat pan as the sides of the pan wing up to provide a comfortable base for people to sit in. Normally what we try to do is we try to take it at the lowest point because that's where the individual will be sitting. So what we do is we just try to get a flat edge over the edge, and then we just drop the tape down. So we're about 16 inches.